Hi, my name is Jim Rose. I'm a licensed clinical professional counselor in Maryland, and today I want to talk about the autonomic nervous system. The autonomic nervous system is an extremely important issue when it comes to matters of trauma and addiction. Let me just kind of explain how this thing works. The autonomic nervous system is the part of our nervous system that keeps our bodily functions running. We don't tell our heart to beat, it just beats because the autonomic nervous system tells it to do so. When we eat food, we don't tell our stomach to digest it, it just does it. All of those are automatic functions. Now, as it turns out, the autonomic nervous system has two parallel branches. Technically, they are called the parasympathetic nervous system and the sympathetic nervous system. I can never keep them straight, so I call them the cold zone and the hot zone. In the cold zone, we feel cool, calm, and collected. We are chill. We feel safe. We feel peaceful, restful, thoughtful. Sometimes this is called the rest and digest system. By contrast, the hot zone is characterized by anxiety, stress, racing thoughts. We will feel defensive. We feel like we are in danger. We will be in survival mode. You ever had an adrenaline rush? If you got an adrenaline rush, you're in the hot zone. Ever felt like you're in fight or flight mode? You're in the hot zone. That's what it is, and that's what it's for. The hot zone exists to help us survive when we are in danger. That's why we have it. That's why our ancestors survived in the wild. But we're not meant to live in the hot zone. We're meant to live most of our lives in the cold zone. The problem is that these days, we all have so much stress in our lives that we can wind up spending way too much time in the hot zone, feeling way too much stress, and that has bad effects on our health overall. Okay, so this can actually play out in relationships. In couples counseling, the Gottmans, who are really the foremost couples counselors probably in the world, they'll sometimes have each member of the couple wear a little thing on their finger like the doctors use to take your temperature. Only this one measures your heartbeat rate and your blood oxygenation level, and it has an alarm. The reason for this is that in couples counseling, it often happens that one or both members of the couple will get activated. They'll get triggered into their hot zone by something that their partner has said or done. And when that happens, they feel like their survival is threatened. They really do. Therefore, they'll go into the hot zone. So what happens is if they're wearing one of these little finger clips, the alarm will go off, signaling that their heartbeat rate has probably gone up to 100 or more. Their blood oxygenation level has dropped below 0.95%. And when that happens, the counselor will say, time out, we're not talking anymore. Because when a person is in their hot zone, they're not thinking so good. The blood has flowed from their brain into their muscles because they need to run more than they need to think. It's one of our primitive response systems for survival. Then they will have the couple separate for 15 to 20 minutes because that's how long it takes for our nervous system to calm down after we've been triggered. And then, with any luck, the two members of the couple can talk reasonably to each other. Often, people get triggered into their hot zone because of trauma. Something happens They feel like their survival is at risk. And if it is truly a trauma response, they're not responding necessarily to the thing that is happening in the moment. They're responding to the emotional memory from the past that has just gotten triggered. They're brought back into the past at a moment when they really felt like their survival was at risk, and their body goes through all these physiological changes just as if they truly were at risk. They get the blast of cortisol, which is the stress hormone, and they get the blast of adrenaline, which is the fight or flight hormone, and they are under the grip of their hormones, their physiological changes, until they sense that the danger has passed and they've had their 15 to 20 minutes to calm down. Okay. This has a lot to do with addiction as well, because often people become addicted because they are caught much of the time in their hot zone. They're constantly living in a state of stress. They are constantly living in a state of fight or flight. They never feel safe. They're always in survival mode. It's a very uncomfortable space to live in. And I believe it is for that reason that people get easily addicted to certain drugs. The drugs don't get them out of their hot zone and into the cold zone. What they do is give them a little bit of relief from being stuck in the hot zone. Okay. What can we do about this? I said that by and large, the autonomic nervous system operates without us thinking about it. There's one part where we can actually directly affect this system, and that is by breathing. Normally, we don't think about our breathing. However, we can consciously control it in a way that we cannot control, say, our heartbeat or our digestive processes. If you go swimming and go underwater, you can hold your breath for a little while, right? Or if you're doing some exercises, maybe some yoga, you can deliberately coordinate your breathing with your movement. As it turns out, what we need to bring ourselves from the hot zone to the cold zone is often just a few really, really deep breaths. Now, when we inhale, we stimulate the sympathetic nervous system. That's the hot zone. When we exhale, we stimulate the parasympathetic nervous system. That's the cold zone. So here's my little trick when I'm trying to help people to calm down. Exhale longer than you inhale. Okay? For example, you might inhale to a count of 4, hold it for a moment, and then exhale to a count of 6 or to a count of 8. If you're doing that, you're stimulating your cold zone more than your hot zone, and you're bringing yourself into that state of calmness, feeling cool, calm, and collected. So, just as a reminder, if you or someone you are with gets triggered into their hot zone, encourage them to take 5, 10 deep breaths. Breathe slowly, breathe deeply, exhale longer than you inhale. And then give it a little time. Give it 15 to 20 minutes to allow the hormones to pass through the bloodstream and for the entire physiological system to calm down. Okay?